secret location in room 100 of 540 Jack Gibbs Boulevard. This is Craft. I'm your host, Doug Dangler. Dr. Stephen Sinatra is a cardiologist and author of Heartbreak and Heart Disease, and he believes that some habits could unexpectedly impact your heart health. We'll talk about some of those today. Welcome to Craft, Dr. Sinatra.
Hey, it's great to be here, Doug.
So tell me about some of these little-known things that some studies indicate may have an impact on your heart, things that you might not normally think about as being an issue with cardiac health.
Sure. I mean, first of all, the more common situations that everybody knows is overweight status, high blood pressure, high blood lipids, being a diabetic. I mean, these are all cardiovascular risk factors, but there's lesser risk factors that people are unaware about. For example, sleeping at night. I mean, sleep is probably one of the most important things that regenerates the body. And if you get enough sleep, which is good, I mean, it's, 7 hours, 6 to 8 hours sleep is ideal. But there was a recent study in the European Heart Journal that really, moved me a little bit, because what it showed was the time you go to sleep is equally or even more important than the duration of your sleep. And let me explain. In other words, if you go to sleep after midnight, as opposed to a sweet spot between 10 and 11 o'clock at night, the people in this study, and there was 8,000 people in this study. The study was reported in the European Heart Journal, and they looked at these people for about 5 years. They wore devices on their wrist, and they accumulated data when they slept. It was an interesting study. And over the 5-year period, a little more than 3,000 people developed clinical heart disease. And they broke codes. And what they realized was that this occurred especially more in females than males. So I want to bring that point out. But the people that went to bed after midnight had more heart disease than the people who went to bed between 10 and 11 o'clock at night. And if you went to bed before 10 p.m., you were at higher risk as well. So the best, according to this study, which involved 88,000 people, the sweet spot for getting to sleep was between 10 and 11 o'clock at night. And that resonated with me because in the discussion, they talked about circadian rhythms. And basically, apparently, the circadian rhythms are the rhythms that are the natural rhythms of the body. And when you go to bed between 10 and 11 at night, this supports the natural rhythmic, energetic vibration of the body. It helps to regulate our hormones like cortisol, for example. And again, this is the sweet spot, so it resonated with me.
Mm-hmm. So given that a lot of people have jobs or responsibilities that would make it very difficult for them to go to bed at 10 o'clock, say you're working swing shift and things like that, does that get put into the data as well? Do they look at people that consistently, for example, work nights? And does that allow the circadian rhythms, for example, to reset themselves? Or is it always going to be 10 p.m. is sort of a magical number, even if you can't attain it?
Yeah, actually, that's a really good question. For the natural circadian rhythms to really work, in other words, it's the natural flow of the body, the natural vibration of the body. Apparently that 10 p.m. works.
Well, Dr. Stephen Sinatra, I thank you very much for talking to me today. Where's the best place that people can read online some of the things that you're talking about?
Oh, they can go to drsinatra.com, heartmdinstitute.com, or Pervana.com. That's my healthy food website. There's lots of areas where people can go and get vital information, and it's absolutely free. Those websites just offer a lot of dialogue and lots of pages where people can go and empower themselves, Doug. And that's the secret, is basically people can go and read information, and once they empower themselves, they can become stronger in battling, the ravages of loneliness, despair that are occurring with this pandemic.
Okay. Well, thank you very much, Dr. Sinatra.
Well, thank you, Doug. It was a pleasure.
For more information from my guests, visit www.crafttheshow.com. This is Doug Dangler. Until next time, be creative.